So thank you for everybody for joining this important event. And why it is important, let me, why is it important that we focus on slum population and poverty in slum? Let me just share with you some statistics, huh? And okay, so as we look at the map here, I hope I'm not hiding it. There's a growth number of urban population living in slum, mostly concentrated in Africa and Asia. Uh, this is the percentage as you go from yellow to red and dark red. Is a percentage from 30, 40, 50% of the population living in slum. This is the 2022 data. With this accelerate our urbanization, doesn't accelerate exclusion, doesn't accelerate poverty and multi-deprivation with this. Essentially, we estimate that there's over 1 billion people living in slum today. There's about 350 to 500 million children, which is a huge concern for UNICEF and for development partner, and it could be raising to 1.5 billion in 20 years of time from now, by 2050. So this is a huge concern, and we need to start thinking how are we going to address this thing. This is a global trend. This is paying attention to the future, right? It's really foresight analysis. To focus on two countries that we're going to further discuss today with our guest panelists. Urban slum are growing in India, according to this data, plus 20%, and Kenya plus 40%. These were two countries that we visited, the global evaluation team. Of course, we have not surveyed the entire country, but we did visited some site in both and Kenya as part of this global evaluation. Globally, slum now house nearly 1% out of 4. And these are the source, UNICEF Evaluation Office, this global evaluation that we're doing. Why focusing on children living in slum? Why is it so important? So there's a principle of perhaps as part of the SDG, the no one left behind. They are facing deep overlapping multi-deprivation. So children in slum are 2 to 3 times more likely to die before age of 5 compared to the others. 40% are stunned due to poor nutrition, lacking of access water, sanitation, education, safety, health. They are often invisible in official data and in urban plan. When they are urban plan, they are at higher risk of violence, especially girls and children with disability. The multidimensional poverty, these dimensions of poverty combined together are more intense, more systematic, and more intergenerational. So we need to do something about it. It's the most deprived. It's the one that is left behind. Is the children, as the child live in slum and informal settlement. Is the first one. So from the evaluation, what we saw and what could be a response, and our panelists are gonna mention some of the good practice we saw and what could be done. As I mentioned, they are left behind. They are not invisible in urban data. They are not reflected in budget and in national planning. There's little spending for them. UNICEF, what we found is urban is limited. 20 country mentioned slum out of 160 or 90 country. And even within one country, it's happening at the pocket. It's fragmented. It's not really nationally owned and fully embedded in country program. Rarely. There's a steady growth of national urban policy globally from national government. It goes from 2010 from 50 countries to 150 now that refer to urban national framework, and 78 countries have operational national urban policy. So there's a growing number of countries that adopt and recognize urban as an issue, and they have embedded in the national framework and have a specific policy. So UNICEF and development partners supporting government, it's a growing area. It's something that we need to reflect upon and tackle. Urban capacity of UNICEF is weak. Disaggregated data again in slum populations, especially children, are lacking. It's difficult for us. What we see as path forward, and we're going to discuss that later, we need to make slum more visible, make sure that we identify data, we disaggregate data, local mapping, routine monitoring, and we make it more visible in our advocacy, in our program, in our reach, and in support with our development partner and government partner first, among equal. Integrate perhaps territorial programming, so we can address these areas that we know they are deprived and there's overlapping in deprivation, and shift from vertical structure of programming toward more horizontal or integrate programming, multi-sectoral programming. So perhaps health could be an entry point, and then we had nutrition, we had protection, we had different element of service to the population that needs support and need to get out of the vicious cycle of poverty. We need to embed it as slum into child priorities, CPDs, strategic plan, um, regional plan, or review, national volunteering review, and so forth. And our funding, even advocate for global funding to address this global phenomenon and problem that we see is arising, is growing. So everybody from the north, from the south, need to acknowledge and address this problem. Invest in urban capacity, and that's it for now. So that is why we think urban slum and children in slum and population in slum need to be prioritized and addressed. So thank you.
Thank you, Dennis. Next, we will have Camila Gojobe. I'm going to ask the presenters to keep time. Camila, you have 10 minutes. Camila is speaking on the community challenges, aspirations, and resilience. Over to you.
Thank you so much. So first I'll start on saying what we do at Slum Dwellers International. So Slum Dwellers International is a movement of slum dwellers across Africa, India, and South America. And our focus mainly is to advocate for land, housing, and services in formal settlements. And we do this through our main things. That is, you can just go to the next slide. Uh, So we do our work through organizing groups within informal settlements, and that is organizing women and youth in different groups. For the women, mostly we find them around savings, and for young people, they're mostly around climate-related issues. And one of the reasons why we advocate for more women to be in the movement, because when we go to informal settlements and even at the household level, women are the ones who understand the problems they face and the problems their children face or their families face within a household. So we capacity build women, we do mobilizing, organizing them, and we use community-led data that is profiling immunization to advocate for different things. And also we have different like peer-to-peer learning exchanges where people will go to different countries or even different settlements to understand what other people are doing so that we can have that empowerment and that support within the movement. And yes, that is what we do. So I'll mostly speak on some of the challenges women and children face in the informal settlement. And when we talk about land and housing and services, that is the major issue in informal settlement. And we find there is no proper planning. So that means we live next to each other. Our houses are connected, and most people live in a 10 by 10 room where you live there with your family, and sometimes it's a family of big as 7 or 5, and it's a 10 by 10 room. So there are a lot of challenges that come from there, and it affects the women mostly, and mostly the children, because they're there, they get to see this, and sometimes they might be ignored in the process because um, people are focusing on where the adults might be focusing on where to get money, where, how to do this, and they might be forgotten in the process. So one of the main challenge is poor health in informal settlements. And by this, we talk about access to good health services or just health in general. So informal settlement, most of it we don't have government hospitals around. That means the people might struggle or go far to get to a good health facility. So it ends up most women within the informal settlement, they'll end up um, trying to get um, a cheap a cheap way to a cheap way to get their children to health, and that means just getting medicine and giving their children, which is not safe. And sometimes when you go to even the health services that are around, you find it doesn't have medication, it doesn't have a lot of services. So it means the child will not get proper medication, proper service within that institution. So a lot of women get to carry this burden, and sometimes they'll end up the children not getting enough support when they're sick. And another issue that we have is that is major in farm settlements and that affects children's malnutrition. And this is because of the poverty level within informal settlements. You find a family, they might be getting an income of less than $100 in a day. So $10 in a day. So that means that is focusing on food, and that food is less. That is probably a family might be able to afford only one meal a day. That means that child will not be able to get a full meal, proper meal with diet. And some of the things that is coming up and the youth are doing informal settlements to help cut this is creating um, urban farming within informal settlements to help even the women get access to some vegetables that is cheap, that is organic and clean, so that the children might be able to benefit from this. This is not like in all areas. It might be in some areas within informal settlements, but youth are really thinking out and trying new things to see if they can help children and women within informal settlements. And another thing is education, and this also goes to, you find there is only one school within informal settlements, and an informal settlement might have around more than 100,000 households. That is a lot of people. That is only one public school. That means this public school will have a lot of people, a lot of students going there. Sometimes some parents might not be able to go to this, might not even afford that education. So they might look for other informal institutions that are just around, that are cheap, so that the child might go to school. But this is not a good education for the peoples. That means they're just going there to bypass time. Maybe even the teachers are not well equipped, and they're just going there, and it's not quality education at the end of it. And sometimes even with education, you find some schools are very far, and some children will have to travel far to get access to this education. And this becomes difficult when we face tragedy within informal settlements. For example, we have a flood. That means some children might not be able to go to school because they have to. Um, some within our informal settlements will live within rivers, and that means if the river is flooded, we might not pass, or our houses are flooded. The child might not be able to go to school in the morning, or their clothes are flooded, their books are flooded. That is like the life we live in within informal settlements. And one another big challenge we have is some within some families, because you'll find they don't have enough money. So the children, they'll have to drop out of school and find labor within the informal settlement to help support their family. So we find some houses are headed by even the children themselves. Find the firstborn, maybe the parents are not there, they left because of poverty and they were not able to provide for the entire children. Some children will take up this responsibility and end up ensuring their other siblings are sustained and all that. So we find we have a lot of children who just are there working informal labor. Is not even like you're getting a good job, you're just getting a job that might feed you and your siblings. And another thing is a lot of women also face violence within their household, which end up affecting most of the children. And this one we find most when we're talking about mental health, when we're having discussions, we have support groups within informal settlements when we talk about these issues. And some women will say they understand their children go through this stress. You'll find the mother and father, they're fighting and all that. And there is no support to help the children. They'll end up carrying all this trauma, carrying all these things, and they go to school with that. They get to live with that. And that is how their life is, and that is just how it is. And the last thing is housing, which is one of our core issues that we talk about in informal settlements, and see how we can get affordable housing. And as you can see, that is the room we get to live in. There is no space. Some of the rooms, they don't even have proper ventilation, which end up people getting health implications, and some they can't even afford medicine, and some they get to live, as you can see in the presentation there, we get to live just around garbage areas. And that is because that is the house they can afford, because the farther you are to maybe where there is dam side or river, that is the cheapest you can afford, and that is where you get to live at, because that is what you can afford. And it has health implication to the mother, to the children, to the family itself, and there is nothing they can do because that is what they can afford. And also within the informal settlement, we don't, because every space we get to build houses, because the number keeps growing each and every day. So if we talk about public spaces where we can get kids to play or just hang around, there is nothing like that. There is no just enough space to allow any of that. So you'll find that the space we have is just a corridor where maybe our households are even facing each other, and that is where we're also playing, and that is just how it is in formal settlement. So for us, mostly we continue mobilizing more women in the movement so that they can be able to talk about these issues, they can be able to talk about these solutions, because they're the ones who know what they want, what is happening, and like what kind of solution might be able to help them access these services and have good housing that trickles down to their children being safe and living in a good environment. That is all for me. I'll leave it there. Joe will share more about what we do later on. Thank you.
Thank you so much, Camila from Muungano wa Wanavijiji, for sharing with us the realities of living in an informal settlement. And now we will have a youth representative who is also a child who's living in an informal settlement from South Africa, share with us their insights and experiences. Over to you, very great.
Thank you so much for the opportunity. Good day, honorable delegates, or good evening, or honorable delegates, wherever you are. So when we speak of the SDG goals, we often speak of the future, but the truth is that future is already here and it lives in us children. So we children, we do not only want to be the recipients of development, but we want to be a part of the development because we are active stakeholders, thinkers, and innovators in our own rights. So last year, Save the Children South Africa facilitated a national child-led voluntary national review process on 6 priority SDG. And this process for us was more than a data collection exercise. It was a powerful act of inclusion where we had children from different backgrounds coming together to share their views, we had disabled children, we had children from the rural and the urban areas coming together to share their opinion on what they think about the SDG goals. And this report revealed two undeniable truths. That first is that the progress on the SDGs is uneven and too slow, especially for children in underserved communities. The second thing that it highlighted was that children know what is working and what is not, and they want to be a part of the solution. So with that being said, honorable delegates, I am Velegrave from South Africa, a country where over 10 million people live in slums, which are called townships in our country. And I reside in Alexander, also known as Gomorrah. And that is a place where was once home to a great leader, Nelson Mandela. Despite its connection to such a legendary figure, Alexander, located near the banks of the Joskei River, remains one of the most underserved and one of the most neglected areas in South Africa. Being a resident of Alexander or living in Alexander, I've seen how the harsh conditions can impact children's lives. In our townships, the houses are cramped, the spaces is limited, and the sanitation is very, very poor, with open sewages flowing through the street. And this environment takes away a child's ability to play and enjoy their childhood, which is essential for their development. They usually say that the environment that you come from does not define you, but in actual fact, in some way, it really does, because it can influence a child's ability to dream and aspire for a better future, to be a doctor, to be a nurse, because of the things that they see. Because without opportunities and access to information, the children in slums are often unaware of the possibilities that are available to them, such as engaging in the sustainable development goals, climate change. For instance, if Save the Children had not given me an opportunity to learn about these global issues, I wouldn't be here today. Unfortunately, many children in the slums are left without access to such opportunity, which limits their potential towards a better future. So for once, I migrated with my family from a rural province to an urban province in search of better opportunities. And this move from the rural province to the urban province highlights the inequality, the reality of inequality in our country, where some areas have better facilities than others, which force people to migrate. And this has made me realize that development is not equal and inclusive, and we are leaving people behind in both urban and rural areas, particularly in the slums, or how we call it in my country, townships. And migration in search of better opportunities has led to overpopulation in urban areas, which has then contributed to increased pollution. And the climate change crisis has further worsened the challenges that we face. Recently, severe weather conditions have had a devastating impact, making conditions worse. We've had floods that have taken the lives of children. We had a case where a child drowned and the houses were destroyed. And such events have left many women displaced and have left many vulnerable. We find ourselves now having children who are left alone. We have cases of rape and molestation. We have teenage pregnancies, and then children are forced to work. Now we have child labors in those places. Now, despite the challenges that are faced by the children are taking action to mitigate their solutions through cleanup initiatives along the Joskei River and awareness campaigns. However, these efforts that then the children are making are unsustainable due to a lack of funding, recognition, and resources. So with that, we ask the government to include these communities in their budget and planning processes, ensuring that their needs are addressed and their initiatives are supported. By doing so, we can work towards creating more sustainable communities. And we also urge the government to ensure that development within the country is equitable and that all regions are served equally. And this would go a long way in addressing the challenges faced by communities in slums just like Alexander. Thank you so much for your time.
Thank you so much, Really Great, for sharing your insights. And it is really a great opportunity to hear from children and for us to give platforms to children and young people to talk about their future, to talk about the things that affect them. It will not be possible to find solutions without involving young people. Now I will hand over to the next presenter, all the way from India. We will have, no, this is not from India, sorry. We will have the next presenter, Gonzalo Hernandez, who will be talking about the key challenges and findings from India in the global evaluation of slum-focused child poverty. Over to you, Gonzalo.
Thank you, Mercy. I hope you can hear me. And it's really interesting to listen to Camila and Belgrade sharing their experiences because it rings the bell a lot. I'm part of the evaluation team, and we went to various countries to witness firsthand of the problems of children living in the slums. And I have to tell you that this is one of the most interesting evaluations and eye-opener in evaluations that I've had. So it's great that both Camila and Belgrade are here. And one of the countries that we went to was India. And as you know, India is a very important country for many reasons: the size, the political importance, both in the region and the world. And visiting India has been also very, very interesting as part of this evaluation. I mean, India, for instance, in 2020, approximately 75 million children lived in urban slums households. And this has been growing over the past 10 years by 20%. So this means that what's happening in urban slums is important. And we understand that there are necessities in rural areas as well. But as Belgrade says, we need to recognize the importance of slums and informal settlements in urban areas, because sometimes children there are forgotten and they're left behind because not enough budget is going there. And there are many challenges in India and in other countries. For instance, as I said, urban programming competes for funding against rural interventions in many countries. So we need to be aware of that, the importance of getting budget to these left behind urban areas. Governments and institutions like UNICEF, they work by sectors or departments, which is fine because they specialize, but it's not fine because this makes it more difficult to address the interconnected issues of urban slums. Therefore, a lot of coordination is important for addressing multiple deprivations. Migration of slums and residents complicates service delivery as well. In the case of India, the Indian diversity across the states makes it difficult to address urban challenges uniformly. So you cannot address with one single rule, one single program, what is happening in various states in India. Sometimes slums lack official recognition. Therefore, that makes it more difficult for governments, for institutions to address slums. In the case of India, the institutional setup of rural areas differs from the institutional setting of urban areas. Therefore, we need to adapt what we do in rural areas to the urban areas in a different way. And of course, we understand that both institutions, UNICEF, the government of India is working a lot, but that reach remains limited in comparison to the scale of urban poverty in India. Nevertheless, we saw some international important enablers when we went to India. So, for instance, COVID served as a critical turning point, renewing UNICEF's and the government's commitment to urban slums and informal settlements. Therefore, COVID made us realize the importance of addressing these areas. Sometimes by employing data-driven strategies like GIS mapping or Google Plus codes, UNICEF developed a proof of concept to target interventions. One of the most important elements that we saw in India to favor the work in the slums and urban informal settlements is the strong leadership. When a strong leadership happens, then things can change a lot. So in the case of Maharashtra, uh, both the former and the current UNICEF CFEO, and the urban program specialist Devika, who's here, um, and as well as the Pimpri Chimtwat Municipal Corporation PCMC Commissioner, who is here also, Mr. Shekhar. They all have a very important role to play in improving things, in working for slums in Maharashtra. And therefore, the collaboration with local governments, such as PCMC in Maharashtra, has enhanced UNICEF capacity to reach urban populations. And we saw firsthand this very important initiative called the World Health Action Plan, which is happening in PCMC in Maharashtra. So I want Mr. Shekhar to tell you about this. Thank you very much.
Thank you, Gonzalo. We will now invite Shekhar to speak about integrating health and governance innovation in slum communities. Over to you, Shekhar. Welcome.
Hello, everyone. Good evening from India. Thanks, Gonzalez, for having my segue into the World Health Action Plan. A lot of what Camilla and Valegri said, both the kids from who speak before me, I think one of the very important themes in what, for example, Camilla was saying is a lot to do with what we want to achieve through the World Health Action Plan, where integration becomes a very, very critical component in on various things, especially for the kids. So integration, when we talk about, I think Camilla also did talk about, if we can move to the next slide, please. Camilla also did talk about integration when she said about how various things, for kids living in slums is critical, right from education to livelihood, how, kids have to go work, which is not really a job, but having to do that to feed their families, maybe look out of their siblings, and how various other things like public health, nutrition, sanitation, access to water, access to public amenities become so important. And today, the focus area that I'm talking about is about health. And absolutely, health is something where integration matters much more than many other sectors, because health can't work unless until sanitation is good. Health can't work unless until access to clean drinking water is there. You can't have a good health, especially for kids, if your sanitation is not proper, if the parents don't have a good livelihood where they can feed their kids. So integration is something which is not a choice, it is something that we need to achieve, especially in a multi level government format that we have in India, where we have the federal government, the state government, and the government at the local bodies also. Integration becomes all the more critical. Next slide, please. When we look at how India has moved over the years in terms of various health systems that are available in India, I think primary healthcare is increasingly becoming or coming to the core of the universal health coverage that we intend to provide in India. If you look at the whole, how national health policy, it came in 1983. Then we had the National Rural Health Mission, National Urban Health Mission in 2013. Swachh Bharat Abhiyan, it came for the whole sanitation part, making communities open defecation free. National health policy, again, there was a shift to preventive focus in 2017. We then moved on to comprehensive primary care in 2018 with Ayushman Bharat. And also now new other things coming from Fit India to Poshan scheme, which is for nutrition, various other things. But it's very, very critical that primary healthcare becomes the focus, the core area, the anchor on our entire efforts in delivering public healthcare, especially for the kids, so that it is strengthening PHC can make access very, very important, especially for low income housing communities, slums, where the primary health center is their first touch point, the first standpoint for accessing public health, which can make it more inclusive and effective and efficient, and also ensuring that our tertiary care centers or the secondary care centers are not overwhelmed with people flocking those places and not coming to the primary health center. And in primary health center, I think overall in preventive care, India has done well, I would say, in rural areas, but a huge work needs to be done in urban areas. Next slide, please. Urban areas are especially critical for India. by 2047, which is 100 years, which would be 100 years after independence. Uh, uh, by 2047, almost 1 in 7 people in urban area in the world would be living in India. And the way that we see it, almost 60 to 70% of that urban landscape that will exist in 2047 does not even exist even today. And that's why we have an urban health crisis, which got really underlined, which came in focus during COVID, especially, where we realized that the various issues that we have in urban areas, right from your, population density, with overcrowding strains and resources, which both the kids, Camilla and Valerie, they mentioned in their presentations. Also, some visuals that we saw in Gonzalez's presentation, it's similar, if not very different. Even in India, in my city, in PCMC as well, in few of the areas. Healthcare inadequacy becomes very critical because there is fragmented service which we are able to offer to people. Before COVID, there was a huge focus, or we tended to think that probably in urban areas the private healthcare would take care, but that is no longer the case. There are many epidemiological transitions that are happening in our urban areas. We have cases where we have still cases of malnutrition, but also we have cases in urban areas where we are moving to a lot of non-communicable diseases, right from diabetes to heart diseases to cancer and many other things. So there are very complex shifts that are happening in terms of the health landscape, which we need to capture if we have to provide the kind of public health or the kind of public health ecosystem that we have to provide for our kids. Next, please. That is why, along with UNICEF, almost about 2.5 years back, Gonzalez just mentioned about the whole UNICEF team, Devika, and everyone. We started with what is called as World Health Action Plan framework. The major focus of this framework was to have a bottom-up approach where wards become the unit which try to take ownership of the health in those areas. For example, PCMC has 32 wards and about 8 zones. There are 5 approaches that we're following. First and foremost, data and evidence become something which is very critical. We conducted vulnerability assessment during WAP, during early days of WAP. And we also realized that, for example, we had about 400 kids who were, not going to the school. We could bring them back to the school along with the various organizations working with us. We also are focusing on the data part, which becomes very critical when we look at the health outcomes that we intend to focus on. Local governance, we had various task forces at various levels of the city, which can bring together, which can integrate the entire ecosystem. We also started working on access to basic services, where things like ASHAs and ANMs, for those who are not very well aware, they are the health workers working on the ground. We could bring them all together and have a pyramidal structure in the city where the health plans can go from slums right up to the zones and then to the city. And that's what we are calling as Ward Health Action Plan, where right from every individual slum, about 1,000 population each, can prepare their own health plans, prepare their own indicators, take things in their hands. And that is where community participation becomes very critical on various parameters, like, for example, Mahila Arogya Samitis, which are self-help groups of women, senior citizen groups, youth clubs, etc., which come together and take the community's health into their hands. This also feeds into the various partnerships that we are doing, right from private organizations to civil society organizations to various NGOs to development organizations, and UNICEF along with the cities, tying it all together so that various components can come together and we have a more integrated approach towards dealing with the health. We're also trying to decentralize a lot of powers that earlier used to exist at a central position, so that then we can go on and provide the kind of services that the slums require and that our low income communities require. This also fits in quite well in terms of the various other initiatives that we're trying to take, whether it's in education, whether it's in skilling and livelihood and nutrition. Sanitation is a very critical part of what we are trying to do in Ward Health Action Plan. We are also working with UNICEF, trying to bring 24/7 water supply to one of the particular slums so that the water storage is no longer required and we are able to do away with a lot of epidemiological diseases which could come from that, because water storage is one of the major issues in the slums in our city. So overall, I think Water Health Action Plan is a step in the right direction. We are taking it forward. We are learning on the trot. I won't say that we are there. I think miles to go before we sleep in a way. But it provides a framework not just for us, but a lot of urban areas in India as well. And it definitely has capacity to be scaled up so that we are able to provide the integrated health ecosystem that we need to provide for the kids like Camilla and Veligri and kids in our city as well. Thank you so much.
Thank you, Shikar, for sharing with us the innovations that are happening to support children and communities living in slum communities. Next, I'm going to invite Paula Perez Nieto, who will speak about Kenya's experience with barriers to inclusive, child-focused urban programming. Over to you, Paula.
Thank you very much, Mercy. So I'm going to very quickly talk about some of the things we saw during the evaluation that that Danny and Gonzalo talked about in the case of Kenya, and then sort of talk about some of the opportunities for work in that context. I don't know, Danny, if you had the slides. Great, thank you. Well, just to start by talking about the situation of informal settlements and slums in Kenya. There is a great the increase in urbanization in Kenyan cities is large, over 4.3% per year. And then in some of the cities like Nairobi, there's more than 35% of people in urban areas living in slums. So the conditions, as you saw from some of the photos that Camila presented, are pretty dire. And there's a growth in migration from rural areas to urban areas. But there's also migration from other countries around. There's great level of youth unemployment in rural areas, which is pushing movement towards cities to find income opportunities. As we saw, some of the challenges include huge urban emergencies, floods, disease, and outbreaks in that context that trigger very severe vulnerabilities. There's evidence that shows that slums have amongst the highest rates of zero-dose children, that is, children that haven't received vaccines. This is certainly the case in urban slums in Kenya as well. And the devolution in terms of rural services to urban areas means that that there's more services now in rural areas than there were before, and urban contexts have become more invisible. But there's opportunities there in terms of the coordination with local governments. In the case of UNICEF's work in Kenya, there's an increasing body of work in settlements, recognizing the challenges, but it's still limited and, as Denise was saying, fragmented in that context. There have been some humanitarian responses in the context of COVID that triggered several actions in the context of flood and cholera outbreaks. There are some specific WASH initiatives that are important in terms of improving the access to safe drinking water, some water ATMs for persons in informal settlements to be able to access water, container-based sanitation that we will talk about a little bit more in a moment. So interesting initiatives, still reaching a small level of population. In education, there have been support to early childhood development, and in informal schools. I mean, we saw one of the situations in Kenya informal settlements is that in slums they are not able to. They don't have formal educations or government schools. They're informal educations, as Camila was saying, in general, very poor quality education. And some of those have been supported, but really not through the education system. There's issues around vaccine outreach and health, among others. But these are areas that UNICEF has been supporting to some extent. In terms of opportunities and enablers for UNICEF work in Kenya slums, which is something that we really look forward to. And Joe, who's speaking next to me, will talk more about. There's evidence-based planning with country governments. There's that opportunity. There's a wealth of locally generated data from institutions, research institutions like APHRC that has sentinel sites in slums and collects longitudinal data, both quantitative and qualitative. The Kiva Mashane Trust that also generates geosatellite data and census data in slums. Slum Dwellers International also has its own data that can be used to enrich the evidence base around for planning in this context, given that much of the national representative data that is used by the statistical agency doesn't have the level of disaggregation that is needed. There's opportunities to enhance community-driven programming in collaboration with relevant stakeholders. There's many local stakeholders working in this context, including the city government in Norway, for example, has some initiatives, UN Habitat, Slum Dwellers International, Cities Alliance, among others. So there's a potential for collaboration, certainly with partner with community-based youth networks and women's networks and other networks working particularly in informal settlements. We were able to see some very interesting initiatives promoted by youth organizations that are very active, and UNICEF has a lot of methodologies working on social behavior change approaches with and youth empowerment that can be that can foster these partnerships as well. Again, issues around those children and improving education access is crucial, particularly in terms of transitions from primary to secondary school, which is hugely important. And then obviously the importance of leveraging private sector collaboration in this context. There is a lot of opportunity for private sector and social entrepreneurs to work in this context to help local and national governments to improve the situation. In terms of just very quickly, I believe you're not able to see my slide deck, so I don't know why that is. Apologies for that.
I think I'm sharing. No?
Yeah. Yes. Okay. Yes. Yeah. Well, just quickly going to the next slide on Fresh Life. Just this is a picture of a portable toilet, the bucket. It's container-based toilets in Mukuru and Matare that are promoted by a social entrepreneurship company, Synergy, and it's a very interesting initiative supported by UNICEF that provides alternative to sanitation in these contexts that don't have sewage and where sort of contaminated water is a very important problem. And this works as a franchise, so it provides some entrepreneurship opportunities to locals who manage these, and it's an interesting initiative in terms of cost sharing and community supported models. Just showcasing some of the types of initiatives that can be implemented and scaled. This is something that UNICEF has been supported. And then in the next slide, I just sort of mentioned that there's again emphasizing the issue around youth networks, which we were very impressed about. We saw this photo comes from an art center, youth-run art center in Kibera slum in Nairobi, where local youth engage other youth and children in art activities to prepare them to and to give them alternatives, ways of participating in this challenging context, but also, income generation. They sell their art, they present musical events, and so on. So just highlighting the way they engage, they do recycling, and this is just one of the many activities that youth networks are promoting in this very challenging context. And obviously, there's a lot of opportunities to support these types of initiatives run by organizations like Los Slum Dwellers International, Save the Children, among others. And yes, so I'll hand over to Joe to talk a little bit more in depth about the work that they're doing in these contexts, which is fantastic to see in person. Thank you.
Yeah, I think very much. Thank you very much, Paula. Hopefully everybody can hear me. But before just I dive into how the work we do around data, one of the things that we intend to do, we do in our work, first of all, slums are invisible. Slums are voiceless, and our role is to give a voice to the voiceless, is to put the invisible slums, to bring them to the radar and the attention of the decision makers, the duty bearers, and that's the role we will be playing. And the mapping that the slum dwellers do with the support of SDI basically is to allow them, my apologies, basically is to able to to do a profile of their communities, to understand what are the challenges, what are the priorities, who to engage, and how we do it. We involve communities in collecting their own information. Again, I will agree with everybody. I agree with Jacob, with the previous highlighted education. But one challenge that I would like also to be highlighted, I think when we're looking at the issues of children and the challenges in informal settlement, I think most, if it's government, if it's civil society organizations, the focus is not mainly on children, it's for young adults, teenagers, there's all these programs around skills training, because most of us believe that there are always general assumptions that the younger children, somebody is taking care of that. They assume the parents, they assume the churches, they assume the civil society organizations working in that area. That is usually the assumption. So most of the programming is focused to young adults. A lot of programming goes to that. A lot of resources goes to skills training, go to dealing with early childhood pregnancies, goes to dealing with drug abuse, mental health issues. Nobody pays attention to a certain age because there are all those assumptions. So the children, most of the children are invisible based on the assumptions. The other thing when it comes to solution that was not mentioned, I'd like to highlight it, is a policy engagement. This is a gap. Are there policies that are specifically tailored towards protecting children, towards the rights of children? Yes, most of these countries are signatories to all these United Nations Charter rights of children, to this, to access to this, but in practice, are they being implemented? Most countries, local government, national government, have all these, some of them have got all these very nice policies, international standards, but when it comes to implementation, are they implemented? So a lot of things that were said previously by my colleague Camila around data, around how we use data, equipping community to collect their own data. But our focus has been around we collect data to address land rights, to address housing issues, because we believe if you are going to address development through a housing eye, you will be solving the sanitation. You're talking about children lack of sanitation. You are talking about children having lack of adequate shelter. You are talking children lacking a safe environment to grow. So that's why we work around around housing. We'll solve some of the other. We work around identifying spaces, safe spaces for children. So the kind of mapping we do is collected by young people, and the communities are equipped with enough data that allows them to engage city government, and they're able to prioritize. So from the work we have done, we have seen a lot of coming in. We support city governments, we support county governments, we support national governments in the gaps that they have around data. And I don't want to take much of my time, because I agree with most of the challenges that have been presented here, and I also agree with most of the solutions. Thank you very much, and thank you for having us.
Thank you, Joe Muturi, and thank you to all our panelists for your presentations and insightful data, information about communities living in slums, about the innovation. It's been really insightful. Right now, we will open the Q&A for the audience. Please, if you have questions, feel free to raise your hand or put it in the comment section. I'll ask the panelists to put on their cameras with an exception of really great so that they can answer and participate in the Q&A sessions. Thank you so much. And thank you to everyone who has participated in the comment section with your comments and some questions that we will also answer. Dr. Buji, I see your hand is up. I hope I pronounced your name well. Please go ahead and ask your question.
I need to allow the mic, so I think I allow the mic. You can come in, allow the camera and the mic. Sorry for the logistic. You can come in.
Yeah, thank you so much. Thank you so much, presenter, and thank you for this extensive presentation. I'm the outgoing U.S. focal coordinator for the Office of the African Union Youth Envoy. Our tenure has finished about 3 years ago, so we're still waiting for a new person. So we're still in the waiting. My question now is to everyone here, including the panelists and those watching us from around the world. Are there ways, do we have a plan to have a resolution out of all the suggestions and all of the sentiments that are here? Are we planning to have a special summit solely devoted to this? Are we planning to have mechanisms to see how some of these milestones or some of these challenges are infused into the Sustainable Development Goals? Thirdly, are we actively advocating that since we know that we cannot meet up, the population we have now cannot, the government across the world cannot meet up with building houses and stuff, can we agree that anywhere people are sited, anywhere people are living in, that we advocate that such a place becomes a place of safety, a hub of safety for people? We don't have that now. So that's why you see in Africa, in Nigeria, governments are always demolishing. Oh no, they're demolishing. They're shooting their people. They are putting people into cages, even in West Africa, because they don't want to see slums. Slums are seen as bad things. Whereas, well, from what we are all seeing, slums are a failure for us to anticipate globalization, urbanization, that failure for us to see ourselves as human, failure for us to consider indecent work, failure for us not to plan for opportunities for people to rise gradually. We can say here and say all of all, have a summit that articulates all these thoughts, bring a South African lady to come and explain to them. That's the way we
Thank you, Dr. Gajube. Can you please focus on one or two questions and maybe to whom you would like to address it in the panel?
Oh, the question is to any of the panelists that can, or the organizers that can even. Thank you.
Thank you. Anyone want to come in here? Maybe, yeah. It was loaded.
There's another question in the comment section, maybe as the panelists are preparing to answer the first question. I'll just read out the question in the comment section, which says, the need to work in urban areas is huge, and yet capacities, understanding, and resources are limited. How do we bridge the gap in a time-bound manner? We have another hand as well. So maybe Dennis, you can all we can take 2 to 3 questions at a time. So we will have one more participant, Albertine Uwimana, to ask a question. Then we can have them. We can have the panelists answer that first round, and then we can have another round. Over to you, Albertine.
Thank you, Mercy.
Thank you
please,
very
Albertine.
much.
One question concise or two, and to whom? Thank you.
Yeah, thank you very much. I hope you can hear me well. Yes, my name is Albertine Uimana. I work with UNICEF Kenya Country Office, and I've really been, it's been a pleasure to interact with the evaluation team on this. I think my question goes to all the panelists or whoever feels comfortable to respond. Because we have been working in informal settlements as UNICEF, and the case studies have been presented. I work with the WASH section. The main challenge we have is the sustainability of the services we provide, because in the nature, I think when we call it informal settlements, and someone has written it in the chat, it makes it also difficult to plan for long-term or sustainable services for this population, because by nature they are informal. They are living in not allowed areas, if I can call it. So how can we bring the government to account in terms of actually linking the programming to this as the overall urban planning, and also enforcement and support on social protection to make sure that these people are also given rights to land, given rights to decent housing, and the rest of the services will follow, because someone has mentioned sanitation will follow, water will follow, electricity will follow. But as long as they are called informal settlements and they keep growing, it becomes difficult to plan for sustainable services. Yeah. Thank you very much.
Thank you. It's a good question. Thank you.
Thank you, Albertine.
Oh,
Over to the panelists to answer the questions.
I can
I could take
come in. Yeah. Yes. Go.
I could take Albertine's question. I think great question, and that's as a city administrator, I think that's always a dilemma that you're working with. In India, for example, especially in the state of Maharashtra, we've taken a long shot where we've identified the fact that the informal settlements of the slums are there, and we need to provide basic services. We can't keep saying that they are on lands which don't belong to the dwellers. We can't say that they are on lands which belong to the government. We've realized and we've identified that that is what it is. And meanwhile, we are providing basic services like sanitation. Honorable Prime Minister, Mr. Modi, I think that's one of the shifts that we took when we started to declare, various areas as open defecation free, because providing toilets was the first step towards identifying that reality that we need to provide individual toilets as and when where spaces are available, and community toilets if the space is not available. Similarly for electricity connection, etc. But I think I absolutely hear what Albertine was saying, and I think there's a huge need in all developing countries, including India, for a very, very sharp focus on public housing and how we can keep providing the public housing, how we can probably in a very structured way, like for example, Maharashtra as a state has been transforming a lot of the slums and informal settlements into what we call as SRA projects, where the entire slums are rehabilitated into formal settlements and formal houses and formal tenements. But there are a lot of social issues even there as well. But there are few basic services like, for example, schools, like health, public health, which need not depend on where the informal settlement is. Sanitation, for example, water, for example, those are the services that we can and must provide in whichever way the informal settlement exists.
Yeah. Can I
Thank
jump
you.
in?
Yes, over to Gonzalo.
Thank you very much. I think that one of the issues that Dr. Buche and actually Joe said is that sometimes slums are invisible, and therefore we need to make them visible. And therefore, I mean, I invite the organization to actually make summits or something very, very, very visual about what is happening in slums. I actually would like many people to invite to go to slums, because as soon as you are there, you realize the conditions that are happening. And the paradox, I mean, this is the paradox. People move from rural areas to urban areas to improve their lives, and sometimes their incomes may increase. Nevertheless, the cost of that more income means that because of the lack of housing, poor people have to live in slums and informal settlements, and therefore the basic services daily are really poor. Therefore, the paradox is that you may measure a slight improvement in income poverty. Nevertheless, you can see a reduction in multidimensional poverty because of the lack of services. Therefore, the cost of getting more income means a lack of services for children on a daily basis, and therefore, I believe that we really need more people such as Mr. Shaka, who's here, the commissioner of PCMC. I think more people like him, more people like Devika, because Devika is the only urban specialist in the whole India for UNICEF. So when you combine those two elements, that's a very powerful thing. When you combine the commitment of Mr. Shekhar and the commitment of UNICEF, of Devika, then you see changes.
Dennis, you have your hand up.
Thank you, Gonzalo. And I just want to add, there's a question from Mr. Singh in the chat if you want, but just to add on Albertine's question, it's a very good question. It's a dilemma that we have as UNICEF, and perhaps we need to rethink and change, having a paradigm change how we approach. And so on the governance issue, we often support government, and what you're saying is essentially sometimes the government, and sometimes it's the solution, but sometimes is part of the problem, part of the challenge. In slum and informal settlement, it's not that there's no governance, it's the governance is informal. So we need to identify the entry point. I recall when we visited Matari, I was visiting some school. They were not officially recognized, but they were supported by the community, and they were working, quote unquote. And Joe and Camilla can correct me, but so we need to maybe having a different approach of programming and more adapted to address the complexity of governance, including the informal one. There are slum lords. There are different sorts of power that are different, and we need to understand a bit like perhaps we do programming in the area. We need to address the rule of the lord in the area, in the territory, and see how we can access and provide services and support in providing services. So these are just a few ideas that I have, and I'm happy to have some reaction. Thank you.
Thank you, Dennis. We have a few questions in the comment section. I'll read them out. This is for Mr. Singh. There is a lot of migration from rural to urban areas in the hope for good education, jobs, and health facilities. Is providing quality access to education and health to rural areas is providing quality access to education and health to rural areas one of the solutions? What else do we need to look into? How can rural and urban services work better in coordination? Then we have another one. Thank you for the excellent presentations. What are the opportunities to work with youth to improve livelihoods for youth or children living in slums? Learning from the example presented by Paula and from experiences from youth group presenters, given the serious issues of governance and access to services in these contexts. How can UNICEF support any youth groups? This would be for our colleagues Joe, Camilla, and Veli Great. Then there's one from Nisera. Just curious, are there any laws on child protection when it comes to eviction? And the last one, can the speakers comment on the collaboration, if any, between UNICEF and UN Habitat in this area of work? Over to our panelists to answer the questions.
So for the question that Jayashree asked about, rural areas and urban areas, sorry, I took that. Do you want it to go in the order in which you said? Yeah.
Please go ahead. And then we
Okay.
can have
So
Paula
yeah,
answer.
the question that Jayashree raised is quite pertinent, and that also ties up with what we as a country took a long time to realize in many ways. You know, for decades and decades, we did focus quite a bit on rural development, right from our public health programs to nutrition to education to so many other things. Consequently, we did neglect urban areas to a very large extent. Over the past decade or so, that shift has changed. So it's no longer either or. You know, you need to keep doing that in rural areas, but you have to understand that people will move and migrate where the jobs are. People will move and migrate where the livelihoods are. And to think that the migration will not happen from rural to urban is not going to happen. It is absolutely going to happen, and we are going to see that shift. The only thing is how we can prepare ourselves in the urban areas so that as Albertine was saying, the problem for housing can be managed. And it's a very critical issue. Often people keep giving example of Singapore, which is a great example, by the way. But it's good for a small country, maybe for a country as huge as India with so much population, it can be really challenging. Finance, resources, etc., everything becomes a question. So it is absolutely, not the case that if we provide a solution in rural areas, people will not migrate, people will still migrate. Uh, and I don't know if in a country as complex in India, we can really coordinate between rural and urban areas because migration patterns are absolutely crazy in India. In my city, I have people from across the country, from each and every state. So I think we need to keep doing more and more as far as education and health, even in urban areas are concerned. We are still lacking in that, and much more investment and effort is needed in that direction.
Thank you. Paula, you wanted to answer?
Yes, just quickly on 2 points on the youth and the UN Habitat, and then obviously it'd be great if the youth participants can also add to this. I think what we saw in the evaluation was really, let's say, encouraging in terms of the action and spaces for participation, not only the ones I mentioned in Kenya, but also in Colombia, for example. We saw very interesting initiatives where youth groups were working in informal settlements to engage in a series of actions to promote economic transformation in the communities at at the scale that they could, often working with recycling it with a strong sort of focus on issues around climate, for example, around protection, motivated by issues around gender-based violence, for example. So that there's a lot of scope for the recognition of youth and adolescents, and obviously engaging children in identifying what these problems are. Joe spoke about it. I mean, often children are assumed to be included in some of these actions, and they're often not when their voices are not heard. So, integrating this into different the work that different organizations such as Save the Children, UNICEF, do in terms of methodologies to ensure that this participation is then linked to more advocacy and policy engagement is important. They have a huge sort of wealth of mechanisms for resilience in these communities. The youth groups working there. So I think that they can be very key in this transformation if provided more sort of policy space to push forward those actions. I think that's important and should be. I'm also interested in hearing what the Valegrate and Camila's opinions are in terms of how they see that these spaces can be carved. And just very quickly on UN Habitat, we saw that UNICEF is definitely collaborating with UN Habitat, particularly more globally in terms of data generation, ensuring that there's analysis of data on children living in slums and informal settlements, identifying spaces for global cooperation on different issues at the more macro level, but we definitely saw that there's not that level of collaboration at the country level, and this is crucial because that's where the tire hits the ground in terms of mobilizing resources and actions. So I think there's some huge potential there for greater collaboration, and that's actually one of the recommendations in the evaluation for closer collaboration. So perhaps over to the youth participants.
Really great. Camila, would you
And
Camila or Belgrade, would you like to comment?
yeah, so you can come in if they want.
Yeah.
They just have to. Oh,
So
maybe I
just
need to
repeating the
allow.
questions that Julie was mentioning, and that maybe we can repeat the question. The question is more in terms of what are the spaces that you see from your perspective as adolescents and youth for engaging more actively in sort of policy spaces to visibilize the situation that you're facing in slums and to find sort of solutions collaboratively with decision makers locally.
Or Julie, you can come as well now.
Okay, just to give them time to respond as they're
Yeah.
thinking about their
Right.
response, I'll read. There are some other comments in the
Oh,
comments, and thank you for those who are already answering in the comments section. Billy Great, would you like to come in now?
yes, I would love to come in now. Could you please repeat the question?
What are some of the spaces, for example, looking at policy, how can youth and young people, children, be supported in spaces, children living in slums, and how can you, for example, how can UNICEF support young people?
Oh, okay. Thank you for the question. So, children can be supported by integrating meaningful participation in decision-making processes. What do I mean by that? I mean that when you are having big conversations or when you are having meetings that discuss the issues that children are facing, you engage them and you ask for their opinions on what they think on the issue, on the issues that whatever you're talking about. Just like right now, we're talking about the problems that children are experiencing in slums. So you need a child to be able to tell you the perspective of the child and what solutions think can work for them. Because if you have you have decisions or then you take decisions without children, you're taking it from a perspective and not really from the ground. And how also is you could invest in awareness, invest in giving awareness to children so that they can know about this issue. So I think that is the support that you can give. Investing in meaningful participation, make sure that children's voices are included in decision making, and also sharing information with them so that they're informed and they know. Thank you so much.
Thank you. Really great for your comments, for your answers. Just one more question on laws. Are there child protection laws regarding eviction of children living in slums? Paula or Dennis, would you like to take that?
I don't believe that there are any specific. I don't know. I can't answer with all the information, but I haven't seen anything specific on that. But as as we were saying, that the important thing is the framework around all the countries that we've been talking about are signatories to the Convention of the Rights of the Child, and there should be a vision from authorities in terms of the best interests of the child, which are not often, unfortunately, taken into account.
Thank you very much. If there are no other questions, I would like to invite the participants to give one comment or one last advice or any burning information that they would like to share, starting with Billy Great, then Camila and Joe, then we will go to the rest.
Some concluding remark if you're welcome to
Joe Muturi, would you like to start? Dennis, could you check if they're muted?
Yeah, no, they should not be. Oh, on your camera, please, so I can see you. So, so Mr. Shakar saying, I see Sanjay saying as well. I would like to hear and Divika, but would like to hear from them. Mr. Shakar, if you want to have some reflection, concluding remark, and do panelists do come in as you see fit or say no. But I see Sanjay, if you want to come in, Sanjay after Mr. Shakar. Over.
I think just one thing, as a lot of people are saying, as uh, you know, uh, if I don't know if I'm pronouncing the name correct, but Puji, right? He asked the question also, and he wrote something on the chat as well, and how how slums are actually a result of a neglect over time, over decades, actually speaking. There's a book called Triumph of the City. It is one of those books, which really delves into the question about slums and why people congregate at the place, why people come from rural areas to urban areas. And whenever we are comparing rural and urban areas, I think urban areas need to be looked at from an aspirational point of view, from the point of view of people migrating from rural areas in search of job, in search of food, etc. And whenever we compare an urban area or a slum, we need to compare it what the situation in the rural area was from where that particular person left that rural area and came to the urban areas. And of course, I think governments can do much, much, much more. The more we do, the less it is. And the time is also running out. So the faster we act on it, the better it is. And I really am of that opinion that the more that we can integrate and bring all the stakeholders, all the departments and various stakeholders together, I think the better that we'll be able to deliver on all these counts. Thank you.
Thank you, sir. Very useful. Really great. And then Sanjay, to introduce yourself and comment on maybe what you hear from India. Really great.
Thank you so much for the opportunity again. So I want to highlight child participation again, that it is important to include children's voices when you are taking decisions that affect them. You need child participation is very important, and children's voices matter. The children are speaking, and the question that I have for you is that, are you listening to them? The other thing that I wanted to urge was my closing statement, that when the last speaker spoke about migration from the rural areas to the urban area, and that is because of development is not equal in countries. You have the government investing more in the urban areas and leaving the rural areas out, forcing people to migrate, and then the population is not evenly distributed across the country. So I also urge them again that development should be equal in countries and should leave no one behind. And I call for equality, or then I preach equality. And again, children's voices matter. Thank you very much.
Thank you. Great point. Really great. Fully agree. Sanjay, over to you. Introduce yourself, please, and maybe you want a few reflection because I want to give the opportunity of you being there. Over.
First of all, thank you, Dennis and Gonzalo, for organizing this. This has been a great learning session, and this entire evaluation exercise has been an eye-opener in many sense, helping us to reflect back on some of these issues which we are discussing. Having said that, I think my concluding remarks would be the need to work in urban and informal settlement is huge. Both, and quality are humongous. It is in India, responsible for urban, and the rest will follow the same line. So whatever we do today is also a kind of benchmark for other states and some of the initiatives that we should saw in other countries. But for me, the not challenge, but the way we approach is, as you rightly said, Dennis, most of us are organized vertically: health, nutrition, education, was. So the challenge is how do you bring all of it together in a informal setting like slums and informal settlement. And for this reason, I think leadership like we saw from Shekhar Singh ji and local self-governance in India provides that opportunity. You can bring multiple inputs and somebody has to anchor that and take that forward. And so the leadership, I would say leadership, partnership, because you can't do everything. You can't do health, education, nutrition, skilling, child protection. So you have to have ownership. And the most important thing, most of the time, the slum dwellers have a different kind of, they don't have a history of cohesion or living together in a community. People are coming from different background and staying in settlement. So how do you, and this is one area wherein we need to learn more and more what kind of structures could be created and sustained, not on UNICEF money, but organically within the whatever the arrangement is there in slums and different countries. But thank you very much. This has been a great learning experience.
Thank you, Sanjay. Sanjay is the chief of field office in Bombay or Mumbai, right? That's the name.
Yes, Mumbai,
Mumbai, but you got it,
Mumbai.
Bombay. Thank you,
Yes.
Sanjay. Over to who else? Okay, I saw. Who else want to conclude next? Gonzalo, Paola, Joe, Camilla.
I can
Just have
go,
a,
and I would like to. I mean, I'm really happy and impressed that and all the memories go back when I see here Sanjay and Mr. Shekhar and Devika and Joe, because I mean we were there with you last year, and we witnessed with you the problems of slums and informal settlements. So it's great to see you again. It's great. Reminding us that you are working really hard on these issues, and there has been some advancements and good news in terms of the things that you do, which is we have to tell the world about what you do in Maharashtra, in Kenya, in Colombia. But at the same time, we need to remind ourselves that that it's not enough because the problems in informal settlements are huge, and therefore we need more resources. We need to make them visible for the rest of the society, because if we really care about leave no one behind, if we don't look at informal settlements and slums, then we are not addressing the leave no one behind. Therefore, we need to really pay more attention. So again, it's great to see you again, all of you.
thank you, Gonzalo. Then over. I would like to be the last to conclude, to thank everybody, but anybody else? No?
Just perhaps one
So,
point about the
yeah.
sustainability that we're talking about. Certainly, the resources are always very stretched, and as the commissioner was saying, you can't neglect rural areas for urban areas or vice versa. There has to be resources for both, attending both situations. And something that we saw that might be sort of important to take into account is this, again, the role of community actors in promoting change and change from within in these structures of informal governance. Certainly, there's a lot of community knowledge. Joe was talking about it, not only in terms of generating data, but understanding issues. And sort of a lot of this sustainability can come from opening the spaces to engage local decision makers who hold the budget and the policy with communities. I think the WAP example illustrates that in practice, that it can really happen, and we saw that happening to some extent in the other context. Certainly in Colombia, one of the good practices that we highlight in the evaluation has to do with this sort of interaction between community-based organizations, so local actors, and promoting change from within. And then obviously a lot of work in terms of working on local level budgets, opening spaces for and ensuring and recognizing that the resources are there to allocate for these local informal settlements. Because of their informality, they're often not recognized in this budget, the local budgeting processes, but it's obviously essential that they're there. And I think a lot of the work that UNICEF does in terms of local level planning can open up the space to inform sort of local level budgeting work with this rich data and information and engagement in terms of participatory action. So that would be my last remark. Thank you very much.
Thank you, Paola. So I just want to acknowledge, I think I just want maybe to finalize this and to first to acknowledge everybody. Nicolas Fermé is also from the evaluation team is there. I don't want to overlook anybody. I want to thank all the participants, especially Mercy, who has been doing a great job in moderating and joining us. And she abandoned her vacation to join us this morning. So I want to particularly thank her. Of course, all the panelists appreciate you. It's late in India. It's early in Mexico, but and in Kenya, it's but I want to appreciate all of you. It's not an easy task, but it's all important that we show that we are dedicated to this issue, and we do want to bring solutions. So a few points I would like maybe from the discussion, I think, and from my own observation is leading this global evaluation. First is, I think the first maybe action that is important that we keep doing and we continue doing is to make the invisible visible, to make sure that we promote the issue, we identify the issue, we advocate for more data, and we and more better understanding of the deprivation that are happening in slum and informality and the various challenge, enabler and barrier that we have. Second, this was, to my knowledge, the first global evaluation on this topic. There's little intervention that is being done by UNICEF supporting and, of course, development partner. Given the rapid growth of urbanization, the rapid growth of number of children, it's important that we do more evidence, that we intervene more, and we learn more. So more evaluative evidence on what work, where it work, for whom, in which circumstance, so we can cross-fertilize learning across region, across country office, across development partner, so we can better serve the one left behind and ensure that there are no one left behind. So I think this is something that it's important. The other thing, and this was really a eye opener for me, especially in Kenya, we know more than what we think. And I'm surprised, I'm shocked sometimes to see our officers very close to the Matari, but 5 miles from Matari slum, one of the biggest slum in Africa, but we do little programming. There's a wealth of knowledge we have seen, there's a wealth of research, there's a wealth of data. But it's very challenging, and it's require my fourth point is require perhaps a paradigm change in the way we program, the way we think. It has to be multi-sectoral, it has to be integrated. I think the good point from the commissioner, health, you cannot have health if you don't have nutrition, you cannot have health if you don't have address poverty, you cannot have health if you don't address sanitation and water. So so we need to address the complexity as a whole, and we need to rethink of programming that is right now sectoral and needs to be more integrated, maybe territorial, but we need a paradigm change. I'm not saying to do things differently, to do another program in parallel, but do things differently, do the right. And perhaps the last point is maybe to do more advocacy and to address more the challenge of informality of governance. So it's not that there's no governance, it's informal, and maybe a good entry point where we have seen in Colombia as well, but I think across the case, is the community is part of the solution. So be localized. There's local solution. The WAP is one good example, and there are one that we have seen in Kenya as well. The community and the local insight are the key point of the solution to address some of the problem that we have seen. So I think it's important that when we program, we localize more and more. So again, I want to thank you all. And I think we'll make sure that the recording and the PowerPoint are available in our website and the EVALSDG website. So thank you, everybody, and I appreciate your insight and your time today, and I wish you a good evening, good day.